So let's start with what are some of the risk factors?
All right. So there are definitely risk factors to suicide, but what we also know is that suicide impacts everyone. Some people are impacted disproportionately or maybe more at risk. So some of those risk factors do include the use of drugs or alcohol, having a previous suicide attempt, having a suicide either in your family, someone close to you or someone who you look up to, even someone in the community. We know that when someone dies by suicide, it makes it that much more real of an option for everyone. Having social isolation as well, not feeling really connected with people. Also having an underlying mental health condition such as depression or anxiety. What we know is that 90% of the people who die by suicide are actually living with a treatable mental health challenge.
Mm-hmm. And what are warning signs to consider?
There's a number of them for sure, Joe. I mean, oftentimes when we think of it, people may say things and talk about things. They may talk about killing themselves or harming themselves.
Mm-hmm.
People may often express a lot of feelings of hopelessness, or even that they feel that there's no reason to live. I think Lance mentioned sometimes that kind of isolation. You may see that going on. People may feel like they're a burden to others, or maybe the friends, family, loved ones are better off without them. And oftentimes people might be experiencing some uncontrollable or unbearable pain, and that could be physical, that could be emotional, spiritual, and it's really kind of hard to quantify. You may see different behaviors with folks, maybe an increase in use of drugs or alcohol, maybe even be looking up or kind of researching different ways of sort of ending their life or methods. Or sometimes you might see people kind of trying to make amends with people or sort of give away prized possessions, kind of almost like making preparations as if they are going to do something. And then their mood itself, you may see some changes. Obviously, sort of depression or anxiety are very common. You may see loss of interest, more isolation from folks. And sometimes folks who die by suicide might be sort of struggling with sort of a feeling of humility or shame about something that they might have going on. And then, I think it might seem counterintuitive, but sometimes people that have been thinking about suicide might often suddenly appear much better. They might seem like a sense of relief or a sudden improvement. And that's kind of hard to explain, but some people believe that maybe they've made a decision and they're feeling a sense of relief about that.